And February is Heart Health Month, and this February, ETMC is opening a new heart valve center.
Doctors Kyle Smith with Cardiovascular Associates of East Texas and Dr. Vivek Patel from East Texas Medical Center's Cardiovascular Institute join us. Nice to have you both here, by the way.
Welcome.
Thank you for having us.
Again, you think about heart valve and heart valve replacement, but what heart valve disease? Let's talk for a bit about that. What exactly is heart valve disease?
Well, in the heart, there's actually 4 major valves in the heart, and what they do is they open to let the blood go forward through the heart, and they close to keep the blood from going backwards in the heart, which is never good. And so if there's a problem with the valve opening or not opening well or not closing well, then you have a heart valve problem.
And what causes a heart valve problem?
Well, there can be different things. I mean, it can be like a congenital problem, something that you're born with, that you may not actually develop symptoms until you're older or later in life. It could be a result of like heart failure, a result of a heart attack, or as people get older, sometimes the valves just stop working like they should.
Dr. Patel, if you've got a bad valve, what are the options of getting it fixed?
Well, obviously that treatment decision is very individual, but I think there's 3 common scenarios that we most often see. One is if a patient only has mild or moderate heart valve disease. Most of the time, those patients are candidates just to be watched with serial echocardiograms to see how their heart valves are doing over a period of time. The second scenario that we see is patients with severe valvular disease and symptoms. And typically, we recommend either of those valves be repaired or replaced.
Okay. And tell us a little bit about this new ETMC Heart Valve Center. What does it offer for East Texans?
Well, it's a new concept that we're trying to develop in order to promote both the education about heart valve disease among the community and practitioners. The other interesting problem with East Texas is the large geographic area. And I think a lot of patients have difficulty making multiple visits to the doctor. So we're trying to integrate a lot of those services together and make it more convenient for them to come and get seen by their physicians.
Is this something, doctor, we hear so much these days about non-invasive surgery. When you're talking about heart surgery, can this also be non-invasive to a point?
Well, yes and no. Certainly there are some new treatment options on the horizon that are being developed, but so far most of those devices have only been approved for inoperable patients. I think we're going to see a big revolution in the next 5 to 10 years, though, as far as the treatment of heart valve disease and as those treatment modalities get better.
The best defense is good offense, though, when you have heart valve problems. Again, diet, exercise, what can you do? Once you found out you have this problem, medications and diet, what do you